Hi, my name is Elizabeth Niemeyer, and the health topic I chose for my presentation is neurodevelopmental disorders. I will explore the potential positive effects of lifestyle changes on the specific neurodevelopmental disorders of ADHD, autism spectrum disorder, anxiety, and depression. The reason I chose this topic is because of my family background and personal connections. These disorders run heavily in my family on both my side, my husband's side, and now with our children. I also have friends whose children are affected by these disorders. The behavioral issues that are prevalent with these disorders can significantly impact the dynamic and atmosphere of a family. Parents and individuals are left making some hard choices. How much is this behavior impacting everyone's lives? Should we try therapy? Is therapy working? Is therapy enough? Do we medicate? Are the long-term side effects of medication worth it? What are the impacts of not taking medication? Are there any other options? All in all, what is the best choice? While medication is a valid option and a personal decision, many individuals and parents are hesitant to go the medication route due to fear of side effects. Some of the potential side effects of ADHD medicine is heart disease, high blood pressure, seizures, irregular heartbeat, the risk for abuse and addiction of drugs, skin discolorations, low or no appetite, weight loss, sleep problems, social withdrawal, and as the medication wears off, increased activity or a bad mood, which we call a rebound effect, tics, which is involuntary and unwanted muscle movement, delays in growth, drowsiness, stomach pain, nausea, tiredness, drop in blood pressure, and becoming more dazed than usual, irritability, and nervousness. Antidepressants and anti-anxiety meds also have side effects, such as insomnia, skin rashes, headaches, joint and muscle pain, stomach upset, nausea, diarrhea, reduced blood clotting capacity, and increased risk for internal bleeding, racing heart, sweating, high fever, high blood pressure, delirium, risk of suicidal thoughts, hostility, and agitation in children, teens, and young adults. While these side effects aren't felt by everyone, the idea of exposing yourself or your children to these side effects can be a very daunting decision to make. Autism. Very little has been known about autism up until recently. It's still a very new area of exploration. The symptom cluster of autism has been well known. However, what the actual disorder is, or what's going on, and why is still widely unknown. Autism is a complex developmental disorder. It is characterized by restricted and repetitive behaviors and impairments in social communication and interaction. Often, unusual rapid brain growth during infancy and early childhood is seen. This is linked to atypical connectivity of brain regions and underdeveloped neural pathways and unintegrated neurological reflexes. If you look at brain scans of an autistic brain, the synapses firing and where they fire look very different from a non-autistic brain. Autism has been viewed for a long time as something you could not cure. However, if you take a different approach to the condition and help create lifestyles that negate the symptoms, often the person increases in their functionality. ADHD. ADHD is characterized by difficulties with attention and/or hyperactivity and impulsivity. It is suspected that the HPA brain network is affected. The HPA is made up of the hippocampus, prefrontal cortex, and the amygdala. The HPA is responsible for cognition, learning, and emotional regulation. Atypical connectivity is seen in these networks. It is hypothesized that there is atypical connection in the reward system as well. Dopamine production is responsible for the reward system. Dopamine levels are frequently low in an individual with ADHD. When the system is dysregulated, the individual will frequently overestimate the value of short-term reward and undervalue the long-term rewards. Planning and decision-making is affected by this. Depression and anxiety. Depression and anxiety work in tandem. Depression is the body's natural response to chronic anxiety. People with depression frequently have heightened levels of cortisol. Cortisol is responsible for giving energy during stressful situations. However, chronic high cortisol levels may disrupt the HPA network. The amygdala is frequently referred to as the lizard brain. In other words, it's the part of the brain that is connected with survival. The prefrontal cortex is responsible for cognitive functions as well as regulating the emotions that come from the amygdala. The hippocampus is responsible for memory and learning. Because the brain is such a complex organ and it is a challenge to thoroughly study it, much of the treatments for neurological disorders have been guesswork. As technology and medicine moves along, some of the old ideas are being discarded and there are some new hypotheses coming out. Some of these are that the hippocampus is one of the few brain regions that has been shown to be able to grow and create new cells. This is called neurogenesis. The hippocampus is frequently smaller in depressed patients. BDNF, brain-derived neurotrophic factors, which help regulate neuroplasticity, which is the ability to change, and neurogenesis is at a low level in people with depression. Cytokines are proteins that the body makes as part of the immune system. Cytokines are released in response to stress, infection, increased cortisol levels, and inflammation. Patients with depression have been shown to have higher levels of cytokines. Immune dysfunction may be responsible for the hippocampus, prefrontal cortex, and amygdala dysregulation that disrupts neurogenesis and neuroplasticity. With the rise of social media, it seems that no topics are banned. In this case, it can be both a positive and a negative. On the one hand, people are beginning to open up about what it's like to live in their own heads and their lifestyles. This connects people, and as we know, community serves a positive function in our lives to know that we are not alone with our struggles. However, as you can also see, that while social media has spread a lot of information about neurodivergence, a significant portion of people still don't know what it really is and have readily accepted common myths and stigmas as truth. Some of the well-being habits from this course that can positively impact neurodevelopmental disorders are exercise, dietary choices, meditation, and sleep. The commonality of many of the disorders I've discussed are inflammation, heightened cortisol and cytokine levels, disrupted neurological connections, and smaller brain tissue in the HPA system. Exercise alone has a tremendous effect on the brain. Aerobic exercise releases hormones such as dopamine, serotonin, and various endorphins, which have a similar effect to opiates and cannabinoids, which decrease cortisol levels. Inflammation is also decreased, and BDNF is increased. BDNF stimulates the hippocampus to generate new brain cells and encourage connections. Dietary health. Because the HPA systems in the brain is linked to the gut-brain axis, Dietary choices are highly suspect in these disorders. When the microbiome of the gut is compromised, the lining of the gut is impaired. This is referred to as leaky gut syndrome. When the gut leaks into other systems, the body perceives this as an attack and increases its immune response. This manifests in multiple ways. One of those ways is inflammation. When the HPA system in the brain is inflamed, it impairs the cognitive functions, the emotional regulation, memory, and focus, as well as other functions. Meditation is another practice that can be useful. Meditation is shown to combat cortisol levels, thus helping the memory, focus, and emotional regulation. Sleep. Sleep deprivation is another area that is shown to impair functions that are controlled by the HPA system. Sleep is important because it helps to utilize BDNF to detoxify our brains while we sleep. Sleep helps with restoration, memory consolidation, and processing. When we lack sleep, our brains are desperately searching to make up for it. There's a saying, pain demands medication. When our brains experience the discomfort of sleep deprivation, we naturally seek medication, so to speak. This may be cravings for carbohydrates, caffeine, nicotine, or other comforting behaviors. Our bodies then have a lowered immune response, which also leads to inflammation. So why is this important? The quality of life of an individual with neurodevelopmental conditions affects not only themselves, but their loved ones as well. If these conditions go untreated or undertreated, this can show up as higher divorce rates, medication side effects, lower self-esteem, higher dropout rates, growth impairment, higher risk of addictions, higher incarceration rates, and higher risk of suicidality. On the other hand, getting intelligent help can lead to improved self-esteem, improved relationships, full body health, reaching full potential, and sustainability of treatment. This affects the individual, but also the parents, spouse, or caregivers in positive ways. The issues described with all of these neurodevelopmental conditions have overlapping symptoms. They seem to be a hamster wheel effect with chicken and egg questions. Because our brains are as much a part of our bodies as the rest of us, it's reasonable to assume that our psychological and physiological symptoms are connected and will impact each other. I won't claim that autism and ADHD can be cured, or that anxiety and depression is simple to cure. However, these well-being habits could very well lead to a more normative lifestyle benefiting the individual and their community.